7, maxillary lateral incisors. So first we're going to start off with some very important information regarding location. And it is located in the maxillary right quadrant and in sextant number 2. It's also very important to be aware of the eruption dates as to the root completion. This tooth usually erupts around the ages of 8 to 9 years old, and the root completion is usually at 11 years old. This tooth is also known as succedaneous because it replaces primary tooth D. I'd like to mention that the lateral incisors erupt right after the central incisors. So now I'm going to go over the functions of the tooth, and the first one is just to bite and to hold the food, and the second one is biting and cutting because the triangular proximal form. And I just wanted to stop and say right here that you're going to hear several similarities between mine and Rosemary's tooth because the maxillary central incisor and the lateral incisor resemble each other almost exactly the same in all views. However, my crown just tends to be smaller and rounder in form. So now I'm going to be talking about the different views of the tooth. So that's going to be consisting of the crowns, ridges, phosphase, pits, and grooves. But the first view I'm going to be talking about is the labial view, also known as the facial. And it's really important to know that it shares the similarity with the central yet again. It contains 3 round bumps of the incisal edge called mamelons. So right here, and usually these bumps are from the enamel fusing together, and they're usually seen on developing teeth, so more as children, and they can be removed over age, actually over time, or with odontoplasty surgery. Alright, moving into some voiceovers because I'm sure you guys are tired of just seeing me stand there and talk. So now I wanted to use this reference image to show you the 3 mamelons on the incisal edge of the lateral incisor. So although this is a picture of the central incisor, this still is a great representation because, as I said earlier, the central incisor and lateral incisor are almost the exact same in every single form of view, just my crown tends to be a bit smaller. And just as the central, it's good to keep in mind that the mesial contact with the maxillary central is at the incisal third of the tooth. So now moving forward with the lingual view. So the crown is pronounced lingual surface with the centered cingulum, and I labeled my cingulum here on my model with the gold, so you can see it's centered, and it has prominent marginal ridges. So I've also labeled all my ridges on my tooth model in the silver glitter, so you can see that. And the crown is also a lot narrower on this side rather than it is on the labial surface. The centered cingulum has a deeper lingual fossa. So the fossa on my tooth model is labeled in green. And as I said before, this is the cingulum. And the 3 marginal ridges it consists of is the mesial marginal ridge, this is the distal marginal ridge, and this is known as the linguo-incisal marginal ridge. And all these ridges are known to be very straight and they are very well developed in size. A more in-depth concept of the lingual view, it has a horizontal lingual groove and it separates the cingulum from the marginal fossa. So I put my groove in glitter blue so you can distinguish from the cingulum, which is the gold glitter, and the fossa, which is the green, so you can see it's right in between both of these features. And I also wanted to add in the lingual pit, which I colored in red glitter so you can distinguish. And I wanted to say it is much more common on the lateral incisor than it is the central. And it is located on the incisal surface of the cingulum, as you see here, and it is located along the lingual groove, which is right here. Alright, so now I'm going to be discussing the proximal view of the tooth and the incisal view on the same slide. So this reveals the crown of the lateral incisor is triangular on the mesial surface. So right here what I'm displaying for you on the tooth is the mesial surface of the tooth. And also be very aware that similar again to the central incisor, the mesial side has a CEJ, and the CEJ is located this area right here, and it's more curved on the mesial surface rather than on the distal, which is this side. And for incisal view, again, as I said earlier, all you need to know about the incisal is that it is a round and oval shape. So one thing I did not mention in my tooth model presentation was the other two variations. So the lateral incisor has 3 variations, and as you can see, I have labeled and presented every single feature on the first variation. As for the other two, they are still very important just to be aware of what the features are. Additionally, on the second variation, present on the lingual surface may be a vertical linguogingival groove that originates in the lingual pit and extends cervically and slightly distally onto the cingulum. The linguogingival groove may extend onto the root surface. The groove is also more common on this tooth than the maxillary central. And lastly, for the third variation, this is more of a rare feature, but the root has a deep distolingual marginal groove, which is a development groove that begins on the distal marginal ridge on the lingual surface and extends onto the root. And now discussing the height of contour on the tooth. So for the facial, lingual, mesial, and the distal, it has the height of a contour located on the cervical third. Pokes out right here. The bumps that come out the furthest. And again, I'm going to reiterate, distinguishing from right to left, it obtains a sharper mesio-incisal angle and a rounder disto-incisal angle, so on this side, and a more pronounced CEJ curvature, again, which is located right here on the tooth. Alright, so now I just wanted to get into the line angles. So the lateral incisor has 6 different line angles, and I'm going to start with the mesial side. So right here on this edge is the mesial incisive, and then on the other side that's the distal, so this is going to be the distal incisive. And then on the bottom right here, this area is going to be the labial incisive. So now turning it to the lingual view, we're going to start again. So this is the mesial lingual, and then right here is going to be the lingual incisive, and then on this point right here, that's going to be the distal lingual. Now furthermore, about the general root features and the specifics. So the general root feature is that it usually has no depressions on the proximal surface, and that it obtains just a single root, not 2 or 3 as some other tooth would contain. As for going into the deeper specifics of the root, it obtains its oval on the cervical cross section, which is in the inner part of it, and it's same or longer than central, but thinner. Overall, the conical shape has no proximal root concavities, and the root curves distally. Alright, so now referring back to this image for the clinical considerations, because of the variations in form as well as the possibility of development disturbances, maxillary lateral incisors present challenges during preventive, restorative, and orthodontic procedures. Now, moving on to the second clinical consideration. This is very important for you to remember and to be aware of on the lateral incisor, and this one is referring to variation number 2 and the linguogingival groove. As you can see, I circled the feature on the second variation. So now the linguogingival groove on the tooth deposits can accumulate in this niche-like groove. This feature can then track periodontal destruction apically following the pathway of the groove, and this can result in usually the formation of a localized periodontal lesion, such as an abscess. So a development to be very aware of, and that's very important for you guys to be familiar with on the lateral incisor, is known as partial macrodontia, also known as peg lateral disease. And what these peg lateral incisors describe is a condition where the lateral incisors on either side of the central incisors do not develop correctly, and they're really small. They can often be pointed or sometimes look like a cone shape. Sometimes the permanent adult teeth do not develop at all, leaving only the primary teeth in place. While some people refer to these as peg laterals, a true peg lateral incisor is a term reserved for the underdeveloped adult permanent tooth that erupts after the baby tooth has been lost. So typically, this disturbance leads to a smaller lateral incisor crown or peg lateral, as you can see in some of the pictures I'm displaying. Looks a little funky, I know, but this can be hereditary or may result in from other factors, but this can be improved in appearance with restorative materials or surgery. That concludes my presentation on the maxillary lateral incisor, tooth number 7.
Hi, my name is Rosemary. I'm going to be presenting to you guys tooth number 8. Tooth number 8 is a central incisor that is located on the maxillary right quadrant. It's also located on the maxillary anterior second sector. This tooth is known to be succedaneous because it replaces the primary teeth, letter E. It's important to remember that the eruption of this tooth is at the age of 7 and 8 years old, and the root completion is until the age of 10. Now, the function of this tooth during mastication is to grab and hold and cut food because of its incisor ridges and its triangular proximal form. Another thing to remember is that it's the widest mesial-distally than any anterior tooth. Looking at the tooth from the facial view, you're able to see that it is narrow starting from the cervical third and starts to get wider as it reaches the incisor ridges. At the incisor ridges, you can see 3 round bumpy edges. These 3 round bumpy edges are called mandibles, and they are formed when the enamel fuses together as the tooth is forming. It's mostly seen on children, and they go away as you get older, and it becomes a straight incisor ridge. Above you see 2 development depression grooves. This one is the mesial-labii development groove, and then you have the distal labii development groove. And these 2 grooves divide the tooth into 3 lobes, which is found when the tooth is developing. And this would be the mesial facial lobe, the central facial lobe, and the distal facial lobe. One thing I really want you to keep in mind is that when you're looking at the tooth from the mesial, you can see that it has a rounder shape and has a more defined, rounder distal incisor angle. Okay. Now, looking at the lingual view, you can see that the crown is narrow as it goes down to the lingual incisor ridge compared to the facial view. There's 3 important features that you should keep in mind from the lingual view of this tooth, and one of them is the cingulum. The cingulum is located to the distal. It has a more pronounced distal offset, and it has 2 marginal ridges, which is here in gray. You can see that. This one over here is the mesial marginal ridge, and it's the longest ridge compared to the distal marginal ridge. It also has a lingual fossa. The lingual fossa is wide and deep. Now, this is one type of variation that you can see the lingual view. There's also another 2 variations that you can see. The other one can be where it has a lingual groove just underneath the cingulum, or it can have a lingual pit, which is also right below the cingulum. Now, that is what the other 2 variations are. And one last thing about it is that the curvature is more distally on the lingual view. To continue, looking at the proximal views, you have here the mesial proximal view and the distal proximal view. One important thing to keep in mind is that the mesial has a more pronounced central enamel junction, which is the CEJ curvature. And like I said, it has a more pronounced junction, the CEJ, on the mesial than on the distal. Now, looking at the incisor view, you're able to see the lingual has a triangular shape, and you're also able to see the cingulum, which, as I mentioned before, it has an offset more to the distal, and then you're also able to see the two marginal ridges going down. Also, you can see in this view the incisor edges of the lingual and the labial incisor. Now moving to the features of the root. The root of the central incisor is smooth and straight as it reaches the apex. It's known to have only one root, and it's called conicoid. And if you were to do a cross-sectional cut, it will be a triangular shape. And this root does not have no root cavities on either side, so you won't be able to find that on this type of tooth. Alright, so now I'm going to be discussing about the heights of contours and the lines of angles of the central incisor of this tooth. So the heights of contours, if you were to see in the proximal view, you can see that the facial height of contour is at the cervical third here. And on the lingual, the height of contour is at the cervical third as well, and it has a more protruded convex area. As to the mesial, the height of contour is on the incisor third, and on the distal, the height of contour is at the incisor middle, at the junction of the incisor and middle third. Alright, so the lines of angle of this tooth is, this would be the mesial incisor, this would be the distal incisor. Going to the back, you can see that this is the mesial lingual and distal lingual, and this would be the lingual incisor and the labii incisor.
Some of the clinical consideration for central incisor tooth number 8 is avulsion. Avulsion is a complete displacement of the tooth from the tooth socket, and that occurs because of extensive trauma to the area. It's mostly seen on children, like if a kid gets hit by a baseball and it causes the tooth to completely get displaced from the tooth socket. The other clinical consideration for central incisor is diastema. Diastema is a space that is found in between the central incisors 8 and 9, and that is caused due to a tightly maxillary frenum, and for that reason there's that gap. And the way to close that gap would be through having a procedure done called frenectomy. And the frenectomy, what it does, it removes some of that tissue, and braces would also help and close that gap. And one of the last things to know, and it's really important, is the development disturbance of the central incisor, and one of them is mesial dens. Mesial dens is a supernumerary tooth that is found between the central incisor, and that occurs because of the presence of a tooth germ that is found during the tooth development, and it causes that abnormality.
Alright, so that concludes all the information of maxillary central incisor number 8. Thank you for your time.